हाय फ्रेंड्स। आज मेरे साथ मेरे दोस्त डॉक्टर कल्याण दास है। ही इज असिस्टेंट प्रोफेसर इन डिपार्टमेंट ऑफ प्लास्टिक सर्जरी IPGM in Kolkata. That is my alma mater also. I have done my plastic surgery and MSc from the same institute. तो आज हम डिस्कस करने बैठे हैं कि नॉन सर्जिकल ट्रीटमेंट आजकल बहुत बढ़ रहा है। Doctor, what do you want to say about the surgical treatment?
Most of the patients who come for cosmetic surgery prefers treatments which are less invasive. Starts with non-surgical like Botox and fillers. And we as plastic surgeons should have knowledge and also spread it to the general public or to the clientele about the necessary treatments, the tips and tricks of the treatments, especially the facial rejuvenation non-surgical.
Absolutely. Even in my clinic, being a surgeon and practicing for last almost 20 years, I'll say, initially I used to do a lot of face limb surgeries. But for last, I'll say a decade or more, people are asking me, डॉक्टर साहब ऐसा कोई ट्रीटमेंट है कि कोई कट वट ना पड़े और मैं थोड़ा सा या थोड़ी सी जवान या बेटर दिखने लगता हूँ। Yes, definitely there is an answer with the help of threads, fillers, Botox. So आज देखिए हम लोग डिस्कस करेंगे फिलर्स के बारे में। तो my friend Dr. Kalyan is going to ask some questions regarding the fillers. Common questions.
There are common things which patients want to know about fillers, especially usage in face. Like what is the duration of the effect of fillers? Is it permanent or is it semi-permanent or temporary?
First of all, I tell you, fillers, nothing is permanent in this skin. See, those fillers are made up of an hyaluronic acid which is normally present in our body. So there are pre-filled syringes of the hyaluronic acid and we inject into the different areas of face as per the indication. And the longevity of these fillers is about 1.5 to 2 years depending on the metabolism of the patient, because there are some rapid metabolizer and others like those who are in extreme gymming and extreme fitness enthusiasts, then smokers, alcoholics. In these type of persons, the patient, you can say the effect of filler wheels of early. Vis-a-vis who is a non-smoker and having a very healthy lifestyle. So in general, you can say 18 months to 24 months is the duration of the duration phase.
And apart from these hyaluronic acid fillers, do you use any or do you recommend other fillers which can be used in our daily practice or can be preferred? Or hyaluronic acid is the
Hyaluronic acid is the most trusted, safest and used across the globe. There are permanent fillers also, but because of their side effects and complications, it's not in both. But there are some injectors across the globe who are still using those permanent ones. But most of the doctors and injectors, aestheticians, being plastic surgeons, they are using, and dermatologists too, they're using hyaluronic acid based fillers.
So if I come for a facial rejuvenation and I wanted to have fillers as my first choice, so how do you select patients for fillers? Who are the ideal patients for fillers?
It's a very good question you have asked, Kalyan. Definitely, see what I see as we cross 20 years of age, the hyaluronic acid production and the collagen production is declining. And these are the basic constituents of all the layers of our face or the skin, muscles, fascia, ligaments and everything. Even there's a change in the bone too. So depending upon the indication, what changes they have developed, accordingly we plan out the treatment. Suppose there's a sagginess, so we have to support the ligament so that the patient is having lifting effect. If there is a hollowness, we go on to the sag and loss of fat, atrophy, there are different fat layers are there. So those needs to be filled up or rejuvenated up. So you can say in an aging phase, what we see, there's an hollowness in the temple, there's an hollowness under the eye, the nasolabial fold becomes deepened, the chin becomes upturned, the surface is deepened there, the jaws are there, there's a sagginess. So these are the areas which needs treated. And not only these areas, we see there's a change a bit see. So they have getting kind of fillers made of HM, but different viscosity, which is being used to rejuvenate the lip cells. So that means each and every area of the face can be rejuvenated with the help of filler.
So what will be your advice for patients who wants to know about the immediate side effects of fillers?
See, first and foremost, I tell that these fillers as such done by a properly trained esthetician, being a plastic surgeon or a dermatologist. They know the facial anatomy better and how to avoid complication.
Right.
Because nothing is, I'd say, without complication. Complication may happen in anything. Any simple tooth extraction can lead to complication. But there are norms, we should follow it. So immediately what they can see in is swelling, edema, bit of inwards. These are the immediate things they can notice. But or injection site pain, but usually that subsides very early. Only dreaded thing is you have to avoid and vesicle compromise. That is the only I'll say complication which the injector or the doctor, the esthetician must know where are the main arteries of the face which needs to be taken care so that the vascular incident is avoided.
So fillers are usually very safe. And suppose somebody is getting adequate training and retraining and then injecting, then it's safe in their house. And apart from some local problems like injection site pain, it is not much of a problem. How much is the downtime? I mean, like if somebody wants a erection of the, suppose say teardrop, and you have selected the fillers, and how much you will ask for the patient?
As such, I is saying that nowadays there is definitely technological advancement in the filler science also. So they are less hygroscopic. So that means you are injecting on table, you are getting almost 95 to 98% of the result.
Almost zero downtime.
Almost you will say a zero downtime, might say. But previous days fillers, I'd say when the technology was different, they used to swell like anything. But at least twice or thrice they used to swell. So sometimes the result was really unpredictable. But nowadays, the product which we are...
You can go back to work or whatever they are doing. They can travel.
Yes, they can fly. Definitely they can do their all normal activities. Apart from some general care, I'll say. Like avoiding excess of heat, cold application, avoiding vital facial massage. On the day of treatment, they should not do a facial cleaning with a normal tap water. If at all they want to use, they should use RO water. No makeup on that very day. Very next day, they can put their sunscreen, their normal makeup and carry your normal activities. But obviously, they have to avoid those contact sport activities like football, basketball, kushti, boxing. I think it has to be avoided.
Any local trauma, can be dry by...
Yes, they can dry with this.
If they put on the helmet and the windshield and then for it hits 100%. Anything new which are coming up like fillers, apart from the various generations of fillers which are come up?
Yes.
What are in the future, next 2 years, 3 years, ideas?
Very good question here, Dr. Kalyan. See, whatever fillers we are using, these are the static ones. Like nowadays, the fillers are coming with bio-revolutionize. Bio-revolutionize or bio-voltator or a bio-stimulator. That means along with the amino acid, there is some extra thing is there which is going to stimulate your collagen production in which it is being injected. So so here I say they are going to come in our country also. That means even the effect of the filler is gone, still there will be some collagen and elastin generation into the layer where you have injected the filler. So there will be a cow and in each. So right now at my clinic, I am having a very wonderful product which is a Profilo, which is basically a skin biomodulator. Since that is injected into any part of the skin, it will stay there and it will stimulate the surface to regenerate collagen and elastin. But the only thing is that you require in the repeat session 0, 1 and 6.
just like vaccines that you need multiple doses to attain a certain level.
Yeah.
Virus.
So slowly the deep fillers, which we're injecting on the bone, on the subcutaneous, they will also be having those biostability properties. I think this year, or maybe 2025, definitely in our country, there will be a good. And that's the future.
Wonderful to hear the news that something more exciting and completely different product in potential of a different ability is there. Thank you for your session and throwing some light on the fillers.
So thank you, Dr. Kalyan, and thank you for patient listening to my audience. Thank you.